My name is Paul Baker. I'm one of the trauma and orthopaedic consultants working in the South Tees Hospital's NHS Foundation Trust in Middlesbrough. Having recognised the potential of the geko device, we worked in partnership with First Kind to develop a prospective and retrospective clinical study to evaluate the geko device. This had a number of aims. Firstly, to see whether it was possible to recruit patients with ankle fractures into a clinical study in a trauma setting. Secondly, to assess the tolerability of the geko device in a population of patients that had sustained an ankle fracture. And thirdly, to evaluate swelling reduction by assessing readiness to theatre in the population of patients that had the geko applied, and compare this to a historical cohort. Once they enrolled in the study, the geko was applied above the plaster backslab in the region of the fibular head to stimulate the common peroneal nerve. We've been very impressed using the geko device. In addition to the clinical reduction in time to theatre that we observed during the clinical study, we found it easy to use. We found that patients like having it applied. It's silent so that they can wear it through the night, so it allows them to have 24-hour edema reduction prevention. We also have found that patients like the fact that they can leave the ward and go to other clinical areas, down to the restaurant and to the coffee shop with the device on, knowing that it's helping to reduce their edema. We've also had a number of reports from patients who've asked to continue wearing it in the post-operative period as they became attached to it while waiting for theatre, and found that it helped with their pain control, and they felt lost without it. In addition, patients become increasingly frustrated knowing that they're not ready for theatre, wondering when their edema is going to be down to a level that will permit their operation. Even if they aren't able to go for surgery on the first day that their edema is down, they appreciate knowing the fact that they're ready for theatre and can then be scheduled by their surgeon when a time slot becomes available. Our experience with the geko has been positive. The findings from this study and our experience of its usability and patient tolerability have led to us adopting it for all ankle and hindfoot fractures in our unit. We continue to use it in all of these patient groups and continue to be extremely pleased with the results that we are getting while using the device. The results from this geko clinical study have been extremely encouraging. If evidence continues to support and build on the work that we've done here at South Tees in collaboration with First Kind, it could have a significant impact on the way services are delivered in the NHS.